friends. Good morning, Mr. Mann. My name is Cindy. I am your student nurse today. I am from Glendale Community College, and I'm going to be taking care of you today. Your physician left an order for us, and he wants us to start an IV in your arm. And the reason why he wants you to have an IV is because he wants you to receive IV antibiotics for that kidney infection that you have. And the reason why he wants you to have IV instead of pills is because the IV antibiotics will help the kidney infection to clear up a lot faster, and you'll start feeling better a lot sooner. So what I would like to do is, first of all, put a tourniquet on and just look at your arm and see where there's a good vein to use. Have you had an IV before? Okay, good. So you know pretty much what to expect. Do you have any questions about having an IV? Okay, very good. You make sure that you let me know if you do think of any questions. Okay, I'm going to stay away from the bend of your arm because that makes it more difficult for you to move. And you've got some good choices here. I think I'm going to use this vein right here. It looks like it's nice and straight, and I don't see any valves in it. So this will be a good choice for us. I'm going to loosen the tourniquet, and now I'm going to set up my supplies. So in my start kit, I have the ChloroPrep, a roll of tape, and also the transparent dressing. I am going to tear 2 pieces of tape, approximately 3 inches long, and I make a little pull tab on each one so that I can get them off my gloves easily, and just put it on the dorsal aspect of my hand, and take out the extension tubing and open up my saline syringe, remove the cap, pull back to release the plunger, and then expel the air, and carefully insert the tip of the syringe into the extension tubing, and then prime the tubing. The reason that we prime the tubing is to get rid of all of the air that's in the tubing. And then just loosen the cap and put it back inside of the package. If the cap falls off, that's okay, because it's going to come off anyway. Just make sure that it stays in the package. We put a cloth or a paper towel underneath the patient's arm, and we're going to go ahead and clean the area with the ChloroPrep, and in an up and down motion with friction, and I'm cleaning an area the size of what the transparent dressing will be, so that the skin underneath the transparent dressing will be cleansed also. Now I'm going to let that dry, and while it's drying, I am going to look at the catheter and inspect it. I don't want to inspect it through the cap. I want to take the cap off, and I'm going to turn away from my patient so that he doesn't run away from me. And you want to make sure that the bevel of the catheter is intact, and also that the catheter itself is intact. And then slide it back in. I have all of my equipment on my right side because that's my dominant hand. If you're left-handed, then you would want to set up your equipment on the left side. But I don't want to have to be reaching over myself to get equipment when I'm ready. So now I'm going to take the cap back off my catheter And I'm going to stabilize the vein by pulling very, very slightly. You will find that some people do this, but then that puts you at a higher angle and there's a risk of going through the vein. So I suggest that you do it this way and make sure that your catheter is all the way down and the bevel is up, and then touch the skin and immediately insert the catheter. You can feel a slight pop when you go through the vein, and then slide the catheter off of the stylet as you're pulling the stylet back. And you can see the stylet is in here, so you're doing what you're supposed to be doing. There's the metal stylet or the metal needle. And you want to get all of the white inside the vein. And when you hear that click, that tells you that the stylet is completely inside. So now you want to release the tourniquet. And now what we're going to do is remove this chamber that has the stylet in it. So I'm going to put my ring finger here, and I'm going to grab a hold of the bevel, the hub of the needle, hub of the catheter, set that to the side, and I bring the tubing to the catheter. I do not raise the catheter up because that can cause the catheter to bend. So bring the extension tubing to the catheter, let go, and immediately, next thing I do is put a piece of tape to secure it. Now I have two hands that I can work with, and I'm going to put the transparent dressing on, place it to cover the hub of the catheter, and pull out the paper and set that aside. We're going to use that in a little while. So now we have our catheter secure, and we can use both hands to aspirate and see that we have blood return, and then inject up to 3 milliliters of saline. And when you're injecting, you want to watch the vein up here distal to the insertion site, because the catheter goes up to about here, and so if it's not in the vein, the tissue around here is going to get swollen, so you want to watch here. And I don't see any swelling. The patient's not complaining of discomfort or burning. And now I disconnect the syringe. I'm not going to use it again, so it doesn't matter that it's not capped. And I'm just going to let this lay here. It's okay, because when I get ready to do the antibiotics, I will scrub the top of that, so it's okay for it to lay there. And now I'm going to clamp the tubing. This is a positive pressure cap, and so you clamp the tubing after you have removed the syringe. If you have a negative pressure cap, then you would clamp it before you remove the syringe. Apply the second piece of tape. And now with the pen, you can fill out this portion. It says initials, date, and gauge. You want to put your initials, the date, and time. For checkoff, it doesn't have to be the exact date. We know that you're nervous and you can't remember your name, let alone the date, but make up a date and put the time in there, and then the gauge of the catheter. And then you peel this off. Throw that away. When you put this on the site, you don't want to put it over the insertion site. You really don't even want to put it up here. You want to be able to see the full length of the vein to observe for any redness or swelling. So put it over on the side. And that's it. Now your IV is ready to have the IV antibiotics infused.